Okay. Hi, my name is Brianna. I'm going to be your student nurse today. Could you please tell me your name and date of birth?
Megan Davis, 4/25/1998.
Alright, and I'll check your wristband. And so today I'm going to be doing an abdomen assessment. So I'm going to start by inspecting your abdomen. So I'm going to stand at eye level, and I can see that the contour is flat. There's no roundness or extended stomach. The symmetry, for symmetry, it's symmetrical. There's no masses on one side or elevation. Your umbilicus is midline. The skin tone is even throughout. There's no striae present. There's no visible pulsation, and the hair distribution is not obvious. So everything is expected. So now I'm going to auscultate the abdomen for bowel sounds. And I'm going to start in the right lower quadrant and move clockwise. Alright, and I heard bowel sounds in all 4 quadrants, which is an expected finding. And then now I'm going to auscultate for vascular sounds over your aorta. So I'm going to use the bowl of my stethoscope. Alright, and there is normal pulse for your aorta. There's no sign of a bruit, which is an expected finding. Now I'm going to percuss the abdomen, so I'm going to do it in all 4 quadrants again, 2 spots in each. Okay, and there is tympanic sounds throughout. There is no dullness or dull sounds, so that is an expected finding. Now I'm going to percuss for your CVA tenderness, which will show the presence of a kidney infection. So I'm going to ask you to sit up and turn around. So this is going to be, I'm going to be hitting my hand pretty hard on the back of your lower back, so it'll feel a little awkward. I'm going to place my hand under your 12th rib, and did you feel any pain or tenderness?
No.
Do you feel any pain or tenderness?
No.
Alright, and that is an expected finding, so there's no presence of a kidney infection. Okay. Now I'm going to palpate the abdomen, so I'm going to have you sit back down. Okay, so for the palpation, I'm going to do light and deep palpation. So I'm going to start with the light, and I'm just going to move in circular motions throughout the 4 quadrants. Alright, and was there any pain or tenderness?
No.
Alright, then I'm going to move on to deep palpation, which I'm going to be going about 2 to 3 centimeters deep, about 2 centimeters. Alright, and was there any pain or tenderness there?
No.
Alright, and I didn't feel any masses, so that would be an expected finding. And now I'm going to check for referred rebound tenderness, which would be if you had appendicitis or another infection, then I would press down deep on the other quadrant. So hypothetically, if you had appendicitis in your right lower quadrant, I'm going to, at a 90-degree angle, press down deep, and you would feel pain in your right lower quadrant. Okay, now I'm going to palpate the liver. So for this, I'm not going to use the hooking technique, but I will do the bimanual. So can you like switch, basically doing 180, except if you're on your right side. Okay, so the liver's in the right upper quadrant, and for the bimanual technique, I'm gonna ask you, I'm gonna put my hand under your lower rib, and another one here, and I'm gonna have you take a deep breath in, and then out. Alright, and I was pushing my two hands together, and did you feel any pain or tenderness?
No.
Okay, and I didn't feel the liver or anything, so it's not enlarged or abnormal, so those would be expected findings. And then you can go back to the regular position. Okay, then I'm just gonna palpate the aorta, which I'm gonna use my 2 fingers to do, so do as I forward. Okay, and I can feel it, so it is palpable, and that is an expected finding. So that is everything for the abdomen assessment. Thank you.